Okay, we're recording. So welcome to week 5 already. Can you guys believe it's week 5? I mean, next week is halfway through. Crazy. Oh, here's Sprinksy. Okay. Um, yeah, can you believe we're almost halfway
I'm
through?
here.
There you are.
I was in the waiting room. I just couldn't get in.
Oh, okay. No problem. Great. Well, welcome. So we're in week 5. Crazy, crazy. My updates are that as far as the exam goes, for the most part, everybody did really well. Congratulations. Really good scores on the exam. I think the overall average for this class, this section was, I think, about an 83. So that's fantastic. The overall average for all 5 of our sections was, I think, almost 82. So that's really good. That's really good. So congratulations to everybody that did well. For the few of you that score below a 78, I already have several meetings set up with most of you. I'm waiting to hear for a couple more students. So if you're a student who scored below 78 and you haven't reached out to me, I would highly encourage you to do so. I have lots of tutoring sessions going on this week. I think I have maybe like 18 or 19 scheduled. So that's really good. Students are reaching out, and there's a lot of students reaching out that scored above a 78 that want to go through the concepts they missed. So I always think it's important to go through the exams, or at least go through the concepts that you missed, irregardless of the score you got. We can identify trends. We can identify what you missed in the questions. There's a lot to be said for going through it, irregardless of what your score was. But I really, really would like the students below 78 to prioritize setting up a meeting with me if you already haven't. I have several already set up this week. What'd you think about exam 1? Straightforward? There's no trick questions, right?
It
It
was all
was
right.
it was the questions were set up differently than I thought they were.
Okay, and how are
Like
they set up? What stood out to you? One word,
they were
two
like
two words.
straight to the point. Like it was if you
Clinical judgment,
clinical judgment.
right? That's the next gen. Taking your knowledge and putting it into practice. And if you notice, the first 2 quizzes were clinically focused as well, as is the quiz today. All right, so that's the shift in questions that you see. It's not so much definition based, testing your knowledge. The expectation is you have the knowledge, and now it's time to take care of a client or a patient in the community with that knowledge. That's why we talked about in week 1 that this class is heavily med-surg focused, right? We're taking the med-surg and moving it into the community setting, or peds, med-surg, OB, right? So that's what you saw on the exam, clinically focused. So, or excuse, yeah, clinical. So it's critical knowledge put into clinical judgment. That's the next gen path. Okay. What else do I have to update you on? I'm working on exam 2 blueprint concept guide as we speak. I hope to have that to you in the next couple of days. Today we're going to do the quiz first, and then we're going to cover content from last week and content from this week. All right, we'll cover the notes that I send you. We'll go through that. We'll do some teaching and exercises when we review the quiz. The quiz is a variety of questions from all the different concepts over the last 2 weeks. There were 8 of them. Okay, we did the special vulnerable populations last week, and then this week, palliative care, hospice care, faith-based. So we've covered a lot in the last 2 weeks. Okay, and then next, what are we in? Week 5. So week 4 and 5 we'll cover today, and then next week we'll cover week 6, and that will be it for exam 2. All right, so 4, 5, and 6. And then remember, next week are the exam reviews already for your second exam in week 7. All right, so have a look at that master calendar that I sent out at the beginning of the term. Or I think maybe in week 2 I sent that out. So have a look and see when the reviews are next week and see if you can prioritize getting to one. And once again, I always track after every exam in all my sections, students that attend reviews and scores. And once again, the term after term, the trend shows that students that attend live reviews tend to do better on the exam. So I specifically look at students who attend a review and what their score was. It's very, very positive. So a couple of outliers, but for the most part, it's very positive. So anyway, so take a look at your schedule for next week. What questions do you have of me before we get going with the quiz? Did you find the concept guide for exam 1 helpful?
Yes, I did.
Yes, it was very helpful.
Okay.
Very.
And nothing on that concept guide should have been new to you. All that information was incorporated into your weekly notes, right? The concept guide was a shortened version of it, a more focused version of it. Okay. Let's see, NCLEX. Some of you are submitting me NCLEXs in the 30s. And I've sent it back to you saying, please redo it if you want a higher grade. And so far, nobody's taken advantage of it. Just be careful with your NCLEX. They're intended to help you prepare to take your NCLEX, right? So if you're submitting a score in the 30s, you're probably not getting a whole lot out of that assignment. And I talked about this in week 1. You know, if you get a low score, don't submit it. Look at the rationales and redo it. And then look at the rationales again and redo it.
I think what it is time consuming. Like you have to redo it like 50 questions, the
I
whole
know.
50 questions, and you can't just do like 25 and 25. I think
Right.
that's part of the problem.
Right. I get
And then
that.
we gotta study for other,
I get that. I get that. I just want you to be taking advantage of these
Yeah.
4 NCLEX assignments. They're really good assignments. They focus on community topics, and I just want you to make sure you're getting the full benefit from them. That's all. Okay, let's jump in. The quiz is open. Quiz 3. Got to stay on camera. We'll take about 15 minutes. Don't forget to hit submit. I don't need to know when you're done. We'll go, let's see, it's 1:10. We'll go until about 1:25. How's that? 15 minutes, 10 questions. Take your time. These quiz questions cover a range of topics from the last 2 weeks. So go ahead and take it. When you're done, just keep your camera on. If you need to go take a break or get something to drink, that's fine. Okay?
I'm gonna switch off from my phone to the laptop after the
Okay.
quiz.
Okay. So quiz 3 is open. So go ahead and start taking it. I'm gonna mute everybody and I'm gonna mute myself. Okay. If you have any questions, just send me a message in the chat. All right. Anybody still working on the quiz? Joy, are you able to get in? I have you trying to connect in. Maybe somebody can text Joy and ask her to try and rejoin. Tell her to log off and then try and log back on again because it's not connecting in. Okay. How'd you guys do on the quiz?
Did
Guys, did you
I
guys
got
do-
one.
did good.
Okay. Okay. Joy, there you are. All right, great. All right, let's review the quiz. There's a lot of primary, secondary, tertiary questions in there. And there's a reason for that because there's several primary, secondary, tertiary questions on the exams as well. That's one of the things we talked about in week 1 about really having a solid understanding about the differences in the intervention levels. Okay. So, okay, can everybody see my screen? Okay. Let's go to the first question. School nurse. School nurse is engaging in a primary prevention program. Which intervention is appropriate? Did anybody select anything other than B? Why is B a primary prevention?
Cause there's ways to prevent it before it happens.
Okay.
First,
What is A? What's A? Primary, secondary, or tertiary?
I would say secondary
Mhm.
Why is it secondary?
because of screening for pregnancy.
What is C? What level is C?
The last one, I can't pronounce it.
Tertiary.
Yeah,
Tertiary. And why is it
Tertiary.
tertiary?
Educating.
Because
because they're already pregnant. Look like
Well, they already have a condition, right? They already have a condition. They have gonorrhea, right? And so we're educating them on the side effects of something they already have, which makes it tertiary. What is D? What level is D?
tertiary
Yeah.
Why is it tertiary?
Because it's still
because they're
educating. Oh, sorry.
Go ahead. Someone.
because they're doing a prenatal diet. So is this the one where they're probably already pregnant?
They're pregnant, right?
Okay.
So they're pregnant, so they already have something going on. So remember when I talked about education, is it all 3 levels? This is a good example. All right. Education at the primary level is the correct answer, B. And then you have A, you have education at the secondary level, and then C and D, education at the tertiary level. So remember when I told you in week 1 or week 2, don't let education move you just towards primary. Education is all 3 levels, right? Okay. Question 2. Which counseling is appropriate to provide a pregnant adolescent? Did anybody select anything besides A? Why is A the correct answer?
Because when you're pregnant, you still want to lower your chances on catching an STD from your partner.
Right. So you can still catch STDs when you're pregnant, correct? Everybody's too quiet. Don't make me start calling on people. I need you guys to participate. Okay, B is wrong. Why is B wrong?
Because you gotta change your diet when you're pregnant.
Right.
And
You are
that's
going to need modifications, right?
telling you not to modify, but you have to modify your intake.
Correct. Correct. And what about C? Why is C wrong?
Prenatal care is supposed to be established from when you find out you're pregnant.
That would be the ultimate goal, right? And then why is D wrong?
Because you don't make that decision for them. They didn't mention adoption. You don't mention adoption to them.
That's one way to look at it. Anybody else have a different thought? Or along the same lines? Adoption discussions can be present throughout the pregnancy. Okay, they don't have to be done, early on. I mean, think about it. If a pregnant teen is thinking about adoption, maybe she's not thinking about it till the third trimester. Who knows? Okay. Good job. Question number 3. Which intervention should be prioritized for a child who's witnessed a violent crime? What important word is in that question that will lead you to the correct answer?
Prioritized.
Prioritize. This is a priority question. Okay. This is a
I
good,
got
this
it
is,
wrong.
you did.
Yeah, I did observe for emotional and behavior development. But I
Okay.
guess you get the referral first.
Yeah. How long are you going to observe?
I don't know. I was thinking like immediately after you observed for the
Right.
emotional and behavior
Right.
development.
But what if they don't show any symptoms for a while? That's why it's recommended with kids who have witnessed a violent crime to obtain some kind of a referral to mental health or counseling. Okay, it's prioritized. It's not to say that A, C, and D could not also be correct answers, right? I mean, actually, all 4 of these, if the word prioritize wasn't in there, all 4 of these could be correct, right? So if you get to a question, we went through this on quiz 2, probably quiz 1. If you get to a question where it's not a select all that apply, and it looks like there could be more than one right answer, what should you do?
Pick the
Reread.
most important one.
Reread the question.
Reread the question to see what you missed. I've already met with several students this week and done tutoring, and one of the things that I always suggest is that you use the highlighter. There's a highlighter feature in your ExamSoft for those of you that don't know that. Okay. When you read the question for the first time, use that highlighter and highlight words or phrases or cues that might give you an indication of what you're looking for in the answer. Does that make sense? Does anybody use the highlighter?
I never.
I did for this exam, and it actually did help me.
Good, Mariana, great. Does anybody know that? Is this new to anybody?
It's new to me.
Is it, Kristen? Okay.
Yeah.
Well, I would suggest that you do that, because let's say you read this question and you highlighted the word prioritized. Then you got to all the answers and you got all flustered because you thought, oh gosh, all these could be right. You go back and reread, and what word is prioritized? Or what word is highlighted? Prioritized. Right? So it's a great feature. Great feature. All right. So again, it's asking for a priority. So obtain the mental health referral or counseling, right? Maybe after that's done, You can teach stress reduction techniques, assess family history, observe for emotional and behavioral developmental issues. Okay, but it's asking specifically for a priority. Okay, which nursing intervention reflects secondary prevention for mental health? What's the key word you're looking for?
Screening.
Screening.
Did anybody get this wrong?
Mm.
Screening. So we're screening for depression, anxiety at each encounter. What is B? What level?
Primary,
Why is it primary?
because you teaching the techniques to children like beforehand, I think.
Yep. Yep. You're trying to teach them some stress reduction techniques that may help prevent future issues. What is C?
Tertiary,
Why is it tertiary?
because you checking for the side effects from medications they're already taking.
Okay, keep going.
Thank
Because
you.
They are already depressed.
Oh,
There are-
yeah.
Antidepressants.
Yep, they already have they've been prescribed this for depression. So they already have something. Right? So yes, Joy, you're correct. So part of tertiary is managing, right? Treating, managing. So in this case, this would be managing the side effects. Right? Okay, what about D? What intervention level is D?
Tertiary.
Why?
Because if you're arranging a support group, they have PTSD. They already have this.
They already have the diagnosis or the condition. Right? Great. Which nursing assessment is most important in clients abusing oxycodone? Before we answer this, what's in the question that's important? Couple things. What is?
Most important.
Okay, that's one cue. What?
Assessment.
Pardon me. When you look at the answers, apnea, C is the correct answer because this is also an ABC question. What's AB? What are ABC questions?
Airway.
Breathing
circulation. Yeah.
Airway,
Safety
breathing,
questions.
circulation.
Yep, say they're safety questions. So, well, all of these four may be present. The question is asking what is most important. And because it talks about breathing, we have to consider the ABCs for this question. Did anybody get this one wrong? Okay. All right, which reflects tertiary prevention in substance abuse? Why is C the correct answer?
Because it's support groups. Arranging. And they already an addict.
They already have some kind of addiction, right?
Yes.
Okay. What is A?
Secondary.
Why is it secondary?
Because of screening.
We're screening. What's B?
Primary,
I would say primary, yeah.
Yeah. Why is it primary?
because they don't have the substance abuse yet. They're just getting information regarding it, so they could
Right.
try not to get it.
We're trying to educate them to prevent anything in the future. What about D? What's D? We had a discussion about this in yesterday's. Some thought it was primary, some thought it was secondary. I think it's primary.
Yeah.
Right? Because you're trying to help them with coping mechanisms or role model coping mechanisms so they can roll them out with their kids or whomever, their family, as to prevent substance abuse, right? Number 7. This is an ethics question. What did you read about in your ethics section? What does non-malfeasance mean? What's
Not hurting
non-mal?
someone or no
Say that again.
I say not hurting someone or something.
Do no harm,
Yeah, do no harm. Yes.
right? That's what malfeasance is. Okay, so why is A the correct answer?
Because you provided safety measures that, that's gonna be beneficial and not harming the patient. Like by
Right.
obtaining a new kit, being as though it's contaminated,
Correct.
it wouldn't be right to use a dirty one if it dropped,
That's potentially causing harm,
yes.
right? So non-malfeasance is an ethical principle, one of the ethical principles of do no harm. What is beneficence? It's another ethical principle. It goes right along with non-malfeasance. Beneficence, do good. I mean, ethics is all about doing what's morally correct, right? What's morally right. If there were 10 nurses performing the same procedure, you are ethically bound to follow the policies, procedures, staying within your scope of practice, right? That's what ethics is. You're morally bound to do good and to not cause harm, right? Why is B wrong?
Because you don't
What?
put a feeding tube in someone who could swallow
Right.
perfectly fine.
That's causing harm, right? That's causing harm. What about C? Why is C incorrect?
Don't you always want to document?
Right. So C is incorrect because you're doing harm, right? You're doing harm. What about D? Why is D incorrect?
Supposed to always maintain confidentiality.
What, by not reporting it, you're doing harm, right? Does that make sense?
Yes.
Yes.
Okay. And we'll talk about the ethical principles a little bit when we get to the content. Okay, question 8, couple of hospice questions, end of life questions. Hospice nurse notes that the client's pain is poorly controlled despite having a fentanyl patch and also sublingual morphine as needed. Which intervention is appropriate? Why is B correct?
Is it because you're advocating for your patient and informing the healthcare provider that the medication that you're prescribing the patient isn't working for them or they still have complaints?
Correct. And what kind of client are we taking care of?
A sick patient?
An end of life patient,
hospice
correct?
client.
A hospice patient. So what are the
Like,
what are some of the goals of hospice nursing? What do we want for the client?
Comfort.
Comfort care?
Comfort. Comfort. Are we worried about A?
No.
Why is A incorrect?
It's not providing any comfort. You're
We're
going
not
down.
worrying about addiction at this point, correct? We're focused on comfort care. What about C? Why is C incorrect?
First of all, that's something we can't tell them anyway.
Well, one of our goals
Pain-
in, go ahead.
yeah,
Sorry, go
sorry.
ahead. No, you go ahead, Joy.
Yeah, and like you was probably about to say, the goal is try to, provide comfort and control it, not tell them it should be a pain-free death.
Right, right. It's being transparent with them, right? And yes, you may not have a pain-free death, but we're working real hard for comfort care, right? What's wrong with D?
You cannot put the patch at the same location.
Everybody understand that? You would not put a new fentanyl patch in the same location, right?
I mean, also, if the fentanyl patch isn't working, why are you gonna try to put the same thing
Right.
again?
Exactly. Okay, question 9. The client tells the hospice nurse, I do not understand why God is punishing me. Which response is appropriate? So we always have a discussion about this. The correct answer is B, but a lot of students choose D because we talk about, in the class, we talk about therapeutic communication and acknowledging what the patient says.
And open-ended question.
Yes, it's a bit different in hospice care. Okay. In hospice care, there may be spiritual issues that you, the hospice nurse, are not able to answer. Okay. So when the patient and the client says something like that, maybe it's best to try and find a religious leader or somebody, a pastor, that can maybe come and talk with the patient about this. I wouldn't feel comfortable having this conversation with a patient just because it's not my area of expertise. Does that make sense? And this is a pretty big statement from the client. Why is A wrong?
Because you don't need to be praying over the patient.
Okay. Take that one step
You
further.
need to be praying over the patient, and who lets you? Who knows if they want to be prayed over?
And who says the patient needs forgiveness? Forgiveness for what? You're basically
Exactly.
blaming the patient.
Exactly. Yep. Yep. Great. That's perfect. Right. You're almost validating what they're saying. Right. By saying, well, let's, okay. God's punishing you. Let's pray for forgiveness. What about C? Why is C wrong? Seems a bit insensitive, doesn't it?
Yeah, it's a little harsh.
Yeah. Yeah. And then D. Did anybody choose D? So here's my argument for D. If you ask this question, then you're almost encouraging them to talk about what event or what subject they feel like they're being punished for. Does that make sense?
Yeah, I was torn between D and B. I mean, I went with B, but I
What
was
were you
definitely
thinking about D?
because it was an open-ended question, and you want them to tell you why they feel a certain way, but then
But remember, we're at end of life care here.
yeah.
Do you really
That's
want
the
them rehashing something? I mean, maybe that's an appropriate conversation with a pastor or their religious support person. But for you, I don't know that I'd be comfortable going down that path. Right? What if they start explaining to you things that you're not ready to hear? Do you know what I mean? So that's a tough one. Okay, question 10. So client with metastatic cancer has made the decision to stop all treatments. Which statement by the nurse reflects a respect for the client's autonomy? Autonomy is another ethical principle. What is autonomy?
Is that like advocating for your patient, doing right by your patient?
That's advocacy.
Okay.
That's advocacy. We advocate for our patients. What's autonomy?
Autonomy is self, right? Their self,
Like when they're able to make a self-decision.
Exactly. If they're capable, the ethical principle of autonomy is very appropriate. We want them to participate in their own decision making, right? So the client has made the autonomous decision that they don't want any more cancer treatments. Okay, so what statement reflects this? So A, so they've already made the decision. So a supportive statement would be, would you like my help in sharing this decision with your family? Because you're acknowledging the decision's been made. Now, do they need help sharing it? Okay, what's wrong with B?
The client
Yes.
already made the decision that they don't want any more treatment and they
Right.
trying to push them towards radiation.
Right. Inappropriate statement. They've already made their decision, correct? And then what's wrong with C?
You're like trying to like basically disregard their decision to please their family.
Right. Why would you question their decision if they've made a decision? And then what about D? What's wrong with D?
again, they made a decision to stop all treatments. So
Exactly.
no need to bring up other treatments.
Exactly. Yep. I mean, end of life care, we'll talk about that when we get to our content, but it's it's a very difficult situation. Hospice nurses actually have lots of additional training and education and certifications because there are so many issues that come with end of life care, right? Let's go and take a look at our content. Does anybody have any questions about the quiz? For the ones that you got wrong, do you have a better understanding of why you got it wrong? Okay. All right, let's skip to our notes from last week. So last week we covered, whoops, am I sharing? No. Okay, so last week we covered special vulnerable populations. You had a question about pregnant adolescent, LGBTQ. Where did you find your information for LGBTQ from last week?
It's in the Canvas up under
Thank
the
you, Kristen.
yeah.
Yep. Same with pregnant adolescents. That was also in Canvas reading. Okay. And everybody knows what Canvas reading is, right?
And
it was
modules.
Pardon me?
In the module.
In the module. And there was also a third reading page for mental illness. Okay. So let's talk about teen pregnancy. Okay. We know that there's a correlation between poverty and poor health outcomes for pregnant teens. One of the biggest issues for teen pregnancy is the dropout rate. Okay. As community nurses, and I did this in the high schools I worked in, it is so critical to try and keep these young girls in school throughout their pregnancy and after. Why is that important? Through your reading and preparation, why is that so important?
Education, less likely to be living in poverty.
Okay, what else? Better decision making, maybe?
Yes.
What else? Anybody else? The more we can keep them in school, the better educated they're going to be, and the more capable they may be of making better choices for both themselves and a baby. Right? Pregnant homeless adolescents present even more risks. All right? They have higher rates of sexually transmitted diseases. They have higher rates of substance abuse, addiction, alcohol, much higher risks of poor nutritional status, and a higher risk of poor birth outcomes. Okay? So homelessness teens even present a greater risk than pregnant teens. So let's say that you're a community nurse and you're doing home visits after a teen has had a baby, and you're assigned the new families and you go and visit them. What's that going to look like? What are you going to be looking for? What's positive? What are red flags? What are you going to be looking for?
Breastfeeding cues, make sure she's breastfeeding the baby properly on time.
Okay.
Looking to see if the baby is looking nourished, like color of the baby, color, lips, hair, face, nails, things like that, cleanliness.
Yep.
How she doing with the baby, like is she distant or is she, loving and taking care of the child, things like that.
Yep. Perfect. Joy, do you want to add to that?
Oh, she did a great job.
Yeah, she
listing
did a
all
good
of them,
job.
The condition of the home overall in general.
Yep.
As far as safety hazards and things of that nature.
What Charisse was describing, which is what I wanted to get to, was bonding. All of what Charisse described is the mom bonding with the baby. Does she know how to meet the baby's needs? Okay, that's something that is critical to observe in the home with a new teen mom. What are some red flags? We know, well, let me preface that by saying we know that teen pregnancy is very much at risk for violence, domestic violence, spousal abuse, partner abuse. What would be some red flags when you go into that home? Because as a community nurse, that may be what you're doing. What's going to be some red flags?
The opposite of what she's saying, like bruising, marks on the baby, her connection with the baby. Again,
the environment,
troubled home, and
can it be a lack of essential needs that the baby need, like food and things of that nature?
Does she have the appropriate supplies? What kind of support system does she have, if any? All these factors are really important to assess, right? And I know we do ADPI in the hospital, we go through our assessment, our diagnosis, our planning, but we also do ADPI in the community. So if you were doing a postpartum visit on a teen mom, you need to think ADPI. We just went through, what are you assessing, right? Are you identifying any issues? If you've identified any issues, what's the plan? Right? You got to come up with a plan. Whether it's continued support or referral to social services, whatever the plan is. The intervention of that plan and then the evaluation of that plan. That's your ADPI in this particular setting. Does that make sense? ADPI is not just in your hospital setting. ADPI exists in the community as well. It just looks a bit different. Okay. Here's some examples of primary, secondary, and tertiary prevention with regards to the pregnant adolescent. Let's go through some of them.
Did
Primary.
you send this out already? I'm sorry.
What?
You sent this out already?
Yeah, I've sent it in week 4 announcements.
Okay, thank you.
Yeah, it would have been the weekend before your exam. So some primary preventions or interventions for this particular group: sex education. Early sex education, the earlier the better. Right? Maybe the earlier they get this information, maybe the risk becomes lower for unintended pregnancies or STDs. A lot of schools have done away with their sex education programs. The expectation is parents have these conversations. What if the parents aren't prepared or don't know how? One of the things that we did in our high schools that I worked in was we did information nights for parents. How to have the conversations with your children, right? Parents have to be prepared to have those conversations with their kids. Okay. Secondary. Secondary screening. So identify high risk adolescents that might be at higher risk for an unintended pregnancy. So how do we screen? What would we screen? Maybe look for a history of substance abuse, a history of sexual abuse, physical abuse, emotional abuse, living in poverty, vulnerable women. And once we've identified them as vulnerable, offer pregnancy testing, if they need it, STI screening, contraception. And then tertiary means they're pregnant, right? What are their immediate, when you do your assessment, what are the immediate concerns and needs of this pregnant teen? Do they want adoption information? Do they want abortion information? Are they planning on going back to school if they're not in school? Or are they planning on staying in school if they're still in school? What kind of support services do they have? Also assessing nutritional needs. School, bonding, we talked about. Any questions about the teen pregnant? They're a very high risk, specialized population in the community. Okay, and then our LGBTQ population. If you were a nurse working in a clinic and you were today's group of clients coming in for the afternoon were LGBTQ clients. In your preparation, what are some of the things that you need to be thinking about prior to seeing these patients?
Abuse. 'Cause
Before
some of
that,
them-
before that,
Are they comfortable with themselves in this relationship? Are they happy? I mean,
okay, before that, that's all, you're right. You guys are both right, but what do we have to establish first?
What they identify as?
Pardon me?
What they identify as?
Nope. Yes, before that. Let me make it easy for you. We need to be comfortable with our own feelings. Okay? We as nurses have an ethical obligation to provide culturally competent care to everybody, which includes LGBT families. What is culturally competent care?
non-judgmental.
And having knowledge about the different cultures and understanding.
So there are some nurses that may have a degree of discomfort caring for this particular population when it comes to discussing sexual orientation with their clients. Okay, it's important that nurses, if they have this discomfort, need to try their best to overcome this barrier to be able to competently and culturally care for this population. If they can't, they shouldn't be caring for them, correct? Okay. So what do we need to do? You guys have already mentioned some things. We need to provide a safe environment for them to be able to discuss their sexual orientation. We have to understand our own feelings. Okay. We may, if we're primarily caring for this population, we may want to know the laws in our state with regards to same-sex marriage or this particular population, family structure, right? Safe environment for them to talk and us being able to acknowledge our own feelings. Okay. I think it was Charisse who said, when we're talking with this particular population, open, non-judgmental way in which we collect a sexual and social history. All right. We can't make assumptions, right? Make assumptions based on their appearance or their sexual behavior. Open-ended questions. Okay. So with this particular population, maybe you're not asking, are you married? Maybe you're asking, or asking, do you have a boyfriend or girlfriend? Maybe simply asking, do you have a partner? Right? That's pretty non-judgmental. Do you have a partner? Are you in a relationship? What do you call your partner? Right? These kinds of particular questions allow us to initiate a discussion about whatever relationships they have going on without assuming heterosexuality. Does that make sense? This will be on your next exam. All right. So the most important thing, the few takeaways is being able to identify your own biases, if you have any, correct those if you're going to care for this population. If you're not going to, then you need to find somebody who will, and you need to be open, non-judgmental, and provide them a safe space to be able to communicate with you. Right? Establishing trust. It goes back to establishing trust. Right? Mental illness. Any questions about LGBTQ? The reading page in your module is excellent. Excellent. So I would encourage you to also read that. Well, that was actually part of your assignment from last week. Mental illness. What do we know about mental illness currently in our country? What are we thinking?
The highest.
It's
There's
everywhere.
not much help for people with mental health illness.
It's not enough facilities for them.
And as you're going around your community, whether it's homeless or populations in need, you do see a lot of mental illness, don't you? I saw it in the schools. I mean, prior to COVID, mental illness was an issue, obviously. Post-COVID, it increased exponentially. And the few things I noticed was the age. Mental problems started becoming an issue more frequently in the preschool age, the primary grades. Then the suicide rates increased in the high school age kids. Mental illness is a huge problem in our country, right? Anxiety is expected, common emotion, right? Considered normal and healthy that we experience anxiety. But if that anxiety becomes so debilitating that we can't function in our daily lives, that presents a problem, right? We're all at risk for anxiety and anxiety disorders. right? We're affected, our anxiety can be caused from physical issues, psychosocial issues, developmental issues, cultural, spiritual. All these things have an impact on our lives, right? A lot of times patients with anxiety disorders may have other mental health issues going on, maybe a major depressive order, or maybe a substance abuse or an addiction. Lots of times mental illness does have comorbidities, right? Have you guys had mental health yet?
Next
So-
semester.
Okay, so this is kind of an introduction to mental health. So I've highlighted the 5 mental health illnesses that I want you to be aware of. You can have some questions about these on the next exam. Okay, the first one is called general anxiety disorder. Okay, this is somebody who experiences persistent, unrealistic, or excessive worry about multiple things. And it usually lasts longer than 6 months. Okay, so think about it. It's generalized. You're worried about a whole bunch of things. It's not a specific thing, it's you're worried about everything.
Sounds like me.
Sounds like right now.
You guys. So that's generalized anxiety disorder, right? You're just worried about multiple things at the same time. Maybe if you're Rashima, you are worried about, okay,
10,000 things at one time.
she's
not
worried about
just six.
10,000 things at one time. So should we diagnose her today?
Please give me
So,
something to help my situation.
okay. The next is phobia. What's a phobia? What's a phobia? Does anybody have a phobia? I have a
Fear?
phobia to snakes.
Yeah,
Fear
so
of something.
spiders.
I have snakes.
Fear of.
Huh?
Isn't there like a fear of
Yeah.
heights?
It's an excessive,
I don't like those.
irrational fear of something. All right. It can be with an activity, a situation, or an object. Some people are claustrophobic. Some people don't like to fly. Some people have fear of heights. Some people have fear of insects or animals. Right? It can lead to extreme anxiety, your phobia. Okay? Some people don't like to be in elevators. All right, so phobia is another form of a mental health illness. And then you have your OCD. It's an obsession. We all know what OCD is, right? Obsession, recurrent thoughts about the same thing. You can't stop thinking about it. These constant thoughts create anxiety, right? Feeling compulsive that you have to maybe wash your hands all the time. Okay, or what are some examples of OCD behavior?
Cleaning.
Cleaning. What
I
else?
usually always hear people say with cleaning, but does it just only revolves around cleaning though? Or keeping areas clean all the time?
Well, it depends. I mean, if this is part of your daily routine and it doesn't cause you great anxiety to clean, but once it does, like, oh my God, I get up in the morning, I have to clean, have to clean, have to clean. Right? If it's part of your normal routine and doesn't cause you to stress about it, then that's fine. But what happens is the recurrent thoughts. You can't stop thinking about it. The first thing you think about when you get up in the morning is, I have to go clean the kitchen. I have to go put whatever. Does that make sense? That's the difference. Does that make sense?
Is this similar to like some people that would have to turn on and off the light 3 times before they walk out? Something like that.
Mm-hmm. Mm-hmm. Then, of course, we have our PTSD. Okay, we see PTSD a lot in our veterans. Okay, what's PTSD? So
Traumatic
there's
stress
go ahead.
disorder. Oh, sorry, post-traumatic stress disorder.
And what might we see? What might a client present with with PTSD? What's going on?
Bad anxiety,
Mhm.
severe
Because of
anxiety
Because of a situation that happened in the
that
past.
happened in the past
Yeah.
that really frightened them. Yeah.
Self-harm.
Pardon me?
Self-harm.
Self-harm. Yeah. Right. So it's a remembrance of an event that causes extreme distress, maybe causes nightmares, flashbacks. Okay. We know that everybody's vulnerable to mental issues. Children are at the highest risk for mental disorders. Okay. Due to many, many reasons. Some common reasons: poverty, maybe witnessing violence, being victimized themselves. And then suicide. Suicide, the rates of kids committing suicide is going up and up and up. So that's another form, suicidal ideations of mental illness. The one medication I want you to know about is lithium. Okay, it's right here highlighted in yellow, right? Why do we use lithium? What's it used for?
Mood stabilizer.
It's used for bipolar.
Mm.
Okay, it's a mood stabilizer. Okay, so if you are discharging somebody from the hospital and you're reviewing their discharge instructions and they have been prescribed lithium, here's some important teaching points. I have them highlighted. Encouraging normal salt intake. Report any diarrhea. Report any vomiting, tremors, or lack of coordination. Okay. Questions about mental illness. I know that's a broad overview, but those are the 5 that I want you to have, just know what they are. Be able to, if a client presents to you with these particular symptoms, are they presenting with OCD symptoms? Are they presenting with generalized anxiety disorder symptoms? Are they presenting with phobia symptoms? So just knowing the difference between them. Make sense? And then alcohol, tobacco, and other drug problems. Another big, big problem. Okay. Substance abuse, addiction contributes to so many bad things. Teen pregnancies or unintended teen pregnancies, HIV, STDs, domestic violence, child abuse, car accidents, fights, crimes, homicides, suicides, right? And we all see the trend going up and up every year with the numbers that are reported for overdoses, right? So what contributes to substance abuse? I'll let you answer. What contributes to it?
Problems in the home.
Environment.
Yeah. Peer pressure.
Peer pressure.
Mhm.
Maybe a little bit of heredity,
Yeah.
right? Heredity with history of lots of relatives with alcoholism or substance abuse.
Or maybe depression.
Like I said, a lot of mental illnesses also have comorbidities, and I'd say the same for substance abuse and alcohol abuse go along with comorbidities. Let's say you're addicted to alcohol or addicted to drugs, you may also have an underlying depressive disorder or mood disorder. A lot of times they go hand in hand. Substance abuse, mental disorders. We know that our culture, our physical culture, social, community cultures all contribute. Social conditions, fast pace of life, competition at school or in the workplace, wanting to accumulate material possessions. Right? Look at all the advertising with drugs and alcohol and tobacco. Right? They advertise for their products to make you feel better. Right? Or have more energy. Right? We know that addiction is a health problem. We know that any psychoactive drug can be abused. Okay, here's some definitions on this page that I want you to have a look at. Just know the difference between substance abuse and drug dependent. You should already know this. It's pretty common sense. But here's some definitions for you guys to go through. What kind of psychoactive drugs are we talking about? We're talking about depressants or stimulants. Energy drinks are considered psychoactive drugs. Nicotine, tobacco, vaping, right? Alcohol, cocaine, amphetamines, methamphetamines, all different kinds of drugs that are used and abused. Here's at the end of this section, there's a nice section on how, if you're working in the community, here's some ideas to set up activities aimed at substance abuse for prevention. I can tell you in the last probably 5 years in the school setting, especially in the middle and high school, most of the education I did with these kids was substance abuse prevention. Lots and lots of resources and education directed at these kids on the primary level to try and help prevent it. Okay, so here's some examples. Okay. Questions, there's a lot of questions on alcohol or on substance abuse. I mean, so we've just talked about some very, very vulnerable, specialized, vulnerable populations. Your teen pregnancy, LGBTQ, all your clients with mental illnesses, and then your clients that have substance abuse issues or addiction issues. When you combine those four, that's a lot of people in your community that are vulnerable, is it not? And then throw in the homeless population. So if you're working in the community, you're going to be exposed to lots and lots of vulnerable populations and vulnerable people and vulnerable families. Okay, let's shift to this week and talk about hospice. Okay, really it's hospice, palliative care, death and dying. What's the difference between hospice and palliative care? What did you learn in your readings? What's the difference? There's a difference. Got to know that.
Well, hospice is like end of life care, and palliative care is like dealing with somebody who has like a chronic illness.
Mm-hmm. Yep. So let's say I was diagnosed with cancer today and I had 6 months to live. The next 6 months is palliative care, or maybe the next 5 months is palliative care. And that last month moves from palliative into hospice, right? Where the end is in sight. Does that make sense? So that's how they're different. Okay. So with regards to hospice, palliative care, death and dying, right? We're focused on the needs of the client. We're trying to keep the client comfortable, maintain whatever dignity and self-esteem we can, right? We know pain, the control, comfort, pain control is important. However, the disclaimer is that it's not necessary to keep the client so sedated that they're totally unaware and out of it about what's happening. They don't recognize family members. They can't communicate If they need to go to the bathroom, they can't, they're just out of it. We want to try and not have it that way, right? We want the client interacting with family members. We want the client trying to participate the best they can in their own decision making for what their plan of care is. We know the families have lots of needs when we get into this situation. Okay, but the client is the most important. Family is included, obviously, but the client's needs and their communication is most important. Okay? Obviously, the goal is to alleviate suffering as much as possible. The patient, the clients, and the families have to understand that if we're in a palliative hospice situation, there's no cure. Okay, what we're focused on is improving the quality of whatever life there is remaining. All right, we talked to them about accepting death as a normal and expected part of life. That was in your quiz. Right? Maybe they've chosen for aggressive treatments to stop. Okay, so in palliative care, well, in hospice, but more so in palliative care, symptom management. And the one important thing to note too is the families. They need the support as well. They need the psychological and spiritual support along with the client. And what do you do if you're a hospice nurse or a palliative nurse and you have a family that disagrees with what the client wants? Let's say the client is autonomous and can be part of the plan for what he or she wants, and the family doesn't agree with it. What do you do? That's the most important thing to do. The client is your most important. So you would have to speak with the family, right? And let them know that you're carrying out the client, their family members' needs and their wants and their desires. Right? Interestingly enough, in a hospice patient, sometimes dehydration in the terminally ill has actually been shown to be less painful, more comfortable. Okay, when they don't have a tube feeding, or they're not trying to take liquids by mouth, or have IVs. Sometimes a certain level of dehydration helps these end-of-life patients, along with, where's that? So end of life, I'm going to jump to here. As their death becomes imminent, we talk about that dehydration part. It might actually help them, right? They're going to spend more time sleeping, appetite fades, oral intake falls, urine output decreases. Their vital signs start to go out of whack a bit. Okay, maybe their respirations are shallow and irregular. Okay. Has anybody worked in hospice care? Had a family member, friend go through this experience with somebody?
Yes, I have.
Yeah,
Yeah.
it's hard.
I work at a nursing home and we have a couple of hospice patients.
Okay. So does this make sense? Yeah. Hospice care is tough. You know, hospice nurses need to take care of themselves as well. It can be grueling. A couple of things that hospice nurses need to understand is stages of grief. Everybody's going to be a different stage of grief, including the client. Right? Family members are going to be in different stages. Client may be in a different stage than the family. Right? We don't want to be the ones making decisions for the client and the family if they are autonomous to do it. Faith and spirituality. Has anybody ever heard of a faith-based nurse? So faith-based nursing is based on a particular religion, whether it's in a church, a mosque, a temple that practices a certain religion. There are actually larger congregations that have what they call a faith-based nurse. So whatever you're practicing in whatever setting, this is a particular nurse that is a community nurse, but she adds the spiritual part of the healing into her care. Okay, so again, it's part of cultural competence. This faith-based nurse needs to understand the congregation's culture, its needs, its desires, and she carries out whatever tasks the organization or congregation or temple or mosque, what they want. It may be lots of different functions. It may be doing the new home visits for new parents, especially teen parents. A lot of education, grief counseling, grief support groups. Okay? So know that there is what we call a faith-based nurse. Okay? Faith community nurse or parish nurse, they're sometimes called, specialized nursing practice that's more commonly oriented, it's more community oriented, meaning you're looking at the larger population of whatever the congregation is. And as I said, it incorporates spirituality into your community oriented nursing. Okay? They may put on health fairs. They are hired by the church or religious organization, health education, health promotion, organizing community resources. Okay? They're focused on body, mind, and spirit. I have actually 2 friends that are faith-based nurses, and they have been for years. They do everything with the congregation. They are the go-to. They do the home visits. They do health promotion, health teaching, health support, and they love it. They've been doing it for years. Okay, lastly, let's talk about ethics. Okay, our entire life revolves around ethics, does it not? Ethics is doing good. We deal with ethics, our ethical decision making in our personal lives, in our family lives, in our work lives, right? So there's a couple of ethical principles that I want you to understand, or you're going to be given some scenarios. What principle is that? So we talked about beneficence, do good. We talked about non-malfeasance, do no harm. We've talked about autonomy a few times already today. Autonomy, giving the clients the autonomy to make their own decisions. The other one is called distributive justice. So you are advocating as an ethical principle, distributive justice, that the resources that are available are going to be distributed evenly. Everybody should have the same access to resources. Does that make sense? So those are the 4 principles, and they're all explained in here. The other part of ethics is advocacy. Okay, advocacy is really a core, what's the word? We practice advocacy in our nursing profession all the time. We're always advocating for our patients, right? What's in your patient's best interest? Maintaining confidentiality, acting impartially, trying to carry out the goals and the preferences of your client. Okay, for example, do they have all the information before they sign a consent? Do they have insurance information on where to pick up their drugs? low-cost drugs. We're advocating, we're trying to do good for them. Okay? The other thing that comes up in ethics is moral distress. So if you are not able to care for a particular client because you have moral distress or you have an ethical issue, you can't just abandon the patient. You've got to find somebody that is willing to take over the care. You can't abandon the patient, right? Let's say an example in the community setting. You're working in home health and you're going to visit a client and they're presenting with unwanted sexual advances. And you're just not comfortable going back there anymore. You've got to find a way to transfer that care to somebody who is able to care for a client and is educated on how to ward those off. Does that make sense? That's called moral distress. Okay. Utilitarianism, ethical. That's it. That's all I wanted to cover for that. So I always like to ask the question at the end of the ethics. Have you guys been involved in any ethical issues in your workplace that have caused distress? Nobody has had any ethical issues come up in their workplace. Okay, well, that's a first. Ethical issues are going to come up in your workplace with regards to end-of-life care, cultural care, right?
Yes, I did have one. Sorry.
What did you have? What's the example?
It wasn't really me.
Yeah,
it was my unit,
Mhm.
on trauma unit. We had a code and not everybody did what they were supposed to do in the code. They didn't get the DNR paper until too late, and they had already started resuscitating the patient. This happened like a couple of weeks ago. So they got in trouble, heads rolled, and people have to go to court now. Nurses have to go to court for what happened, and it has to be explicit. They have to go by exact. The person who was supposed to be recording didn't record everything she was supposed to record.
Yeah.
It was a big thing. It's still going on.
Yeah.
Yeah.
That's a great, it's a sad example, but that is a great example of an ethical dilemma that now needs to be investigated for whatever, poor decision making, not following protocol. Ethical issues are going on around us all the time. Okay. Okay, so that's a lot to cover today, 2 weeks worth. Is that helpful information?
Yes.
I mean, these are the concepts and topics we work with in the community. Okay, ethics is everywhere, though. I mean, it's in the community, it's in the hospital setting, it's in the long-term care facilities, it's in clinics, it's in medical buildings. There's ethical issues going on all the time.
It's everywhere.
Everywhere. But if you have that moral compass, those ethical principles, we're just putting a name to them today. You guys are already practicing doing good, doing no harm. Otherwise, you wouldn't be in nursing, right? You're already, we're just putting a label to what you're already doing. But ethics is all about doing good, making the right decisions. What would everybody else do in your shoes? Make sense? Okay. Questions?
I have a question about the HESI assignment.
Yeah.
What we really need to put on the nursing guidelines?
What?
I see what we really need to put in there.
No. So on the HESI assignment, it's asking you to think about ADPI, think about the nursing process. So as you come up on these particular topics, think about clinical, because the HESI is going to be clinical too. Right? HESI is actually very med-surg focused in this class. So you're looking at a certain scenario. How would you like the somebody with anthrax? How might they how would you do the nursing process with them? What might they present with? How is it transmitted? How do you evaluate that the treatment is successful? Does that make sense? I don't need you to write out A, D, P, I, E, and have something for all of it. Just think big picture. Does that make sense?
Yes, thank you.
And remember, this assignment, and next week I am going to, we are going to spend after the quiz or after class next week, since we only have 1 week's of topics to cover, we're going to pull out our HESI prep next week, and we're going to complete what we can. Okay, because after next week, 2/3 of the content is done. We should be able to be completing a lot of that. Okay, so thank you, Stephanie. I'll put that on my radar for next week. We'll pull out our HESI prep, and I'll put that in the announcement this weekend to be prepared to pull that out, and we'll start working on it. If you haven't, hopefully you started working on it. But if you haven't, we'll start working on it together.
Okay,
And
thank you.
remember, you're welcome. Remember, that's your study guide. There's no right or wrong way to do it. Okay, just as you're caring for clients with whatever issue is in the box, are you going to care for them? Okay. Okay, that's all I have for today. Does anybody have any questions? I hope you guys have a really good rest of the week. Thanks for your participation today. I appreciate it. I felt like this was a really good class, very interactive. So thank you. Have a good week. You guys know how to find me. Expect that the exam 2 concept guide, expect that in the next couple of days. Okay.
Thank you. Have a good night. Happy Halloween again.
Oh yeah, happy
Thank you,
Halloween.
bye.
Bye.